So thank you very much. I had shared slides. I'd be grateful if you can upload them on the screen.
I'll ask my colleague Ritika to just share them on your behalf.
Thank you. So I have some 21 slides, but I have 10 minutes, so I would not be really sticking to the slides, but take off from where my co-panelist and dear friend Precious, she set a very sober tone. Please next. On next, when I say next, kindly move the slide because the control is with you. Next, please. You need to move to the next slide. Yeah, so next, please. Next. Next slide, please. Yeah, so as you know, most of you do know that the panel was as a result of, no, when I say next, please do it, then please go to the previous slide. I'm sorry about this.
I think there's just a bit of lag with the internet, Preeti.
I'm so sorry about that. So the previous slide, please. So the focus areas of our panel were that, you know, we learn from previous, it's okay, this is all right. So we are 11 people with relevant expertise, led very ably by Her Excellency Ellen John Sirleaf and Right Honorable Helen Clark. It has been an amazing experience to work with this panel. Next, please. Next slide. So the focus areas were to actually learn from previous pandemics, to review the present and understand how this pandemic has impacted and how the health systems and communities have responded, and how to ensure that, you know, we have an internationally strengthened system, as Precious also very ably said, and nationally robust systems, resilient systems, so that this kind of suffering is not repeated. Next. So the panel actually worked impartially, independently. We all gave our services on honorary basis without remuneration. And in an open and transparent manner, there was lot of interviews, lot of interactions, review of literature, data and evidence guided the work of the independent panel. Next. Next slide, please. Next slide, please. So we discovered that there have been years of warning against zoonotic diseases. If you see the 10 diseases that have been listed out by WHO as you know, emerging global threats, then 6 of them are zoonotic. But there is no you know, system of data sharing between, say, WHO, OIE, or FAO. Though there is a agreement, but there is no framework of sharing data. So we found that this was a great lacuna, and Precious has already spoken about international health regulations. Valuable time was lost. The public health emergency was declared on 30th January. The pandemic was declared on 11th March. So the whole of February actually was a wait and watch by most of the countries. There was no global leadership as such. So there was lack of coordination. People just didn't know what to do. So countries were actually just waiting and watching. And even human transmission was announced, I think, around 22nd of January. By that time, already from Wuhan, travelers had gone to Taiwan, had gone to Thailand, and you know, the spread had already happened. India had its first case on 30th January from with a Wuhan student who returned home. Next. Next slide, please. So it was found that global leadership was absent, and as Precious also said, that there was not adequate funding. International financing was virtually not there or too late. And we have seen how pandemic widened inequalities. Though the WHO staff did work hard, but they were underpowered to do the job demanded of it, because they were not adequately funded, and they did not have the voice or the authority that is required to handle these pandemics. Next, please. Next slide. So basically, the panel's recommendations can be said in two categories. First is immediate actions to end the pandemic. We are seeing, the pandemic coming in waves. The mutations happening despite vaccination drives. We've seen inequalities. So let me focus on that. Next slide, please. So immediately we have said that vaccine for all is the priority. And you will be surprised, I want to share with you that the developed countries, the advanced countries, have actually pre-ordered 4.3 billion doses for a population of 1 billion. So if they actually give 2 doses to the entire population, then also 2 billion doses are surplus. But we find that COVAX already has said that there are 30% shortfall is there in procurement. So we're not going to have equity in vaccines. That is a fact. And that's what we need to address for future. And that's an emergent need. And of course, as you know, South Africa and India have moved a proposal for manufacturers to agree to voluntary licensing and technology transfer. That also decision is still pending. Next. Next slide, please. So we have recommended that G7 countries should immediately provide funding, because again, as Precious said, and as I would like to repeat, that we do not, WHO does not have the money, international organizations do not have the money. If we have to procure vaccines globally, then you see, you need money. So at least 19 US billion dollars are required. Of course, the non-pharmaceutical public health measures, the COVID appropriate behavior is required, and more so because of the kind of waves that countries are experiencing. As you saw, India had the second wave, was very brutal, and now US is again in the grip of third wave, I would say. So therefore, COVID appropriate behavior is a must. And WHO needs to develop a roadmap. Precious also pointed out that a mere meeting will not do. We need a framework. How do you go to the treaty? How do we proceed ahead? So we need very concrete, step forward to ensure that all the findings of the and the recommendations of the panel are actually do see fructification. Next slide, please. So basically, these are the policy recommendations, the B part of our findings. So I have subsequent slides, but what I'm going to do is, to save time, let me just take you through these eight circles. Of course, first and the top is call for immediate actions to end COVID-19, which we already discussed, and elevate leadership to global health. What's happening is that there was no one voice, or I would say a together voice, as to how the world should respond. Why human to human transmission was not declared in time? Why we should not have, we should ban travel temporarily. We should ensure that supplies are maintained. So therefore, this elevation of leadership of global health, the advisor to His Excellency also mentioned that it has to go to the UN General Assembly. It has to be at the highest level. That is why our panel has recommended a global threats council to be formed with the heads of departments, and that's what we are looking for. The next circle is to strengthen the WHO. You see, they are underfunded, they are not independently funded. You see, when the funding is attached to programs, attached to I would say agendas, then WHO cannot act independently. So it has to be independent. So funding is the main thing. Herein we have also said that the DG's tenure should be 7-year term with no re-election, so that there's no pressure on him also. And similarly for the regional directors also, that's also one of our recommendations. And then it's important to invest in preparedness now. And how do we do it? We need to build resilient systems. We need to build supply chains. We need to ensure that I'm sure you recall how, the test kits were not available, PP is not available, masks not available, supply chains disrupted, and how much agony and how much suffering people have suffered. This we cannot have it repeated. So nationally and internationally, it has to be ensured that we invest in preparedness now, and we need a roadmap for that also. The next circle is establish a new global surveillance system. It's very interesting that, we found in the panel that there were these two systems of information coexisting. One was this fast digital, social media with information and with infodemics also, which means wrong information and accurate information too. But as Precious also said, that the international health regulations, the system of sharing data, the system of letting WHO know what's happening in countries or between countries was absent. So data sharing protocols, surveillance system globally between the FAO, between the OIE, between the UNEP, between WHO, it has to be established. Similarly, a similar exercise has to be done within the countries, because you see, we have found that this pandemic can be tackled only through multi-sectoral action. It cannot be done by health ministries alone. It cannot be dealt by WHO alone. So the level of interaction has to be coordinated at a higher level. Next is, of course, establish a pre-negotiated platform for tools and supplies. As I said, this clamor for, let me tell you example of India. You see these test kits, RT-PCR test kits, there is this reagent and there is this probes that we actually import from abroad. Suddenly the supply chains were disrupted. For PPEs, we need cloth from China. We didn't get it. So therefore, there was this huge effort within the country to improvise, to have local manufacturing. We were able to do so, and we are now exporting also. But the pain, the agony was huge. So therefore, we need these regional hubs of tools and supplies across the world. That is what this panel has recommended. And of course, as I said earlier also, you need new international financing for global public health goods. It is a public health good internationally, globally, because unless all of us are safe, none of us are safe. That has been established. A Delta variant somewhere is causing havoc now in US, or some mutation coming in. Therefore, these we need to act together. So we need international, financing, and then we need international coordination, and we need effective national coordination also, because everybody has to come together. It has to be whole of government. It has to be whole of government approach. It has to be whole of international UN agencies approach. That is why the UN General Assembly is so, so important, because that is what will actually establish global and international equity, which is the theme of my address. So I request you to come to my last slide, because I have covered all the other slides within this slide also. Please come to the last slide before. Thank you. Thank you very much. Please come to the last slide. Next. Next. Yeah, yes, this is the one. So the underlying theme, as I have presented to you, is that we need global and regional equity as a prerequisite. And this equity has to be at various levels. In access to information. Information was not forthcoming. You see, social media actually told us about presence of cases. IHR did not. So access to information needs to be strengthened. We need global and regional equity in decision making. It's everybody has to be part of this decision making, because we are a diverse world. We are a world of haves and have-nots. We are a world where the needs are different. So therefore, in decision making, as we've also been saying as a panel, that Act A needs a broader decision making framework. So we need equity in decision making. We need equity in data sharing. And when you talk about data sharing, the issue is a little more complex, I'd like to say to you, because you see, privacy issues are there. We have been requesting WHO to have a framework of law that will actually ensure that data privacy is ensured along with data sharing. And data sharing has to be across platforms, internationally and nationally. And of course, when we talk about funding, when we talk about financing, then in making assessed contributions, it has to be as per ability, with the richer nations paying more and the developing countries paying as per their ability. So in supply of essentials, this is something that has really, bothered me as health secretary when I was handling COVID, the first wave in India. Both for immediate and long-term needs, we need to plan now. This is not going to be the last pandemic. This is not going to be the last big tragedy. So we need to be prepared so that the suffering is mitigated, or that suffering is actually prevented. So in supply of essentials, we need to plan out. And when I say essentials, I mean vaccine also. And in human resource development, we found from national experience, I am telling you that, quickly we needed to empower our doctors, nurses, our volunteers, the public in general, about what this pandemic is about, how to handle it, how will isolation be maintained, what is quarantine. So therefore, we need to use digital tools here, which are very, very important. That's what India did. So we have a platform for training, and this has to be a regular exercise. So internationally, the implication is that we must have toolkits, and we must have toolkits that evolve with the solution, because we have seen this with this pandemic, that situation has been changing every second, third month. Even now it is. So we are still in the pandemic. Therefore, training, human resource development is a very important area where equity both globally and regionally, is an issue. And I think with digital tools, we can overcome that. And I had mentioned that in WTO, South Africa and India have taken up for sharing of IPRs and technology transfer. We must create sustainable supply chains. It's just not that one country is supplying to the whole world. We have to have supply chain hubs. We have to have manufacturing hubs, and that is what will actually make sure that global and regional equity become a prerequisite, which will not be actually hampering our response. So I want to quote from Paul Farmer that a sense of global health equity is the idea that something so precious as health might be viewed as a right. So global and regional equity is our right, and we must ensure that it becomes a fact. Thank you.